So for our case, we have a 16-year-old boy with hypothermia and frostbite. And so for the patient summary, like I said before, he's a 16-year-old male. He was completely healthy prior to the night of admission. And when he was admitted, it was around 6:50 a.m. He was found an hour previous in a snowbank in partial undress, though there were no signs of sexual assault, and he could not remember any signs or any sexual assault happening. He was last seen healthy at 11 p.m. the previous night, New Year's Eve at a party. And for symptoms, he presented with drowsiness, a slow response time, and the bolded ones are going to be pertinent later, but a lack of shivering, a rectal temperature of 88.3 degrees Fahrenheit, and damage to extremities. That night, the external temperature was 5 degrees Fahrenheit with a wind chill factor of negative 20 degrees Fahrenheit, so it was very cold outside. And as you can see in the picture, he's got a discoloration of the legs, arms, buttocks, and toes. Like, they're dusky. That's like the blood pooling in them. And both hands were cold and hard to the touch. The right foot was encased in ice. The left foot was cold but soft. And also in the picture, you can see there are abrasions to the dorsal surfaces of his feet. They were also present on his hands and legs. And a blood toxicology screening revealed that he had an ethanol level of 1,172 milligrams per liter. And so that does just mean that he's imbibed some alcohol. He admitted to that. And the ECG revealed a sinus bradycardia of 59 BPM, arrhythmia, and a small Osborne wave. In the picture, you can see that's an example of an Osborne wave. It's not his specific ECG, but it is a upward deflection at the junction of the QRS complex and ST segment of the ECG, also called a J wave, and it is consistent in known features of systemic cold damage.
A general diagnosis of hypothermia and frostbite was given after a quick look at the patient. Hypothermia is a systemic cold injury, and it's when the patient has abnormally low body temperature below 35 degrees Celsius or 95 degrees Fahrenheit. And it is when the patient's body loses heat due to exposure to very cold temperatures. And there are 3 stages of hypothermia. And in the picture, you can see that the core temperature drops further as the stage progresses from stage 1 to stage 2 to stage 3. There's shivering in stages 1 and 2, and the patient is fully conscious and aware. But by stage 3, the symptoms are more severe. There's no more shivering. There's a reduced level of consciousness, along with reduced respiration and possible organ failure and even death. Frostbite is a local cold injury, and it's when the skin and underlying body tissues in the area becomes very cold and even frozen. Areas of the body that's in direct contact with the cold are most likely to be affected, or the body parts that are most distal to the body's core, like the hands, the feet, the ears, the nose, etc. There are also 3 stages of frostbite, and the symptoms progress from burning and numbness with redness in stage 1 to having that specific area frozen and insensated, along with appearance of black skin in stage 3. After a closer look at the symptoms and conducting a few tests, it's confirmed that the patient has stage 3 hypothermia with his symptoms of lack of shivering, having a core temperature below 32 degrees Celsius or 89.6 Fahrenheit, and the patient's state of undress, which is a paradoxical behavior associated with stage 3. This is thought due to hypothalamus dysfunction, which occurs when the core temperature is below 32 degrees Celsius, which he was. He also has stage 3 frostbite with a frozen right foot and partial freezing of both left and right hands. There is development of a hemorrhagic blisters after rewarming of the limbs. There's variable perfusion and necrosis of the fingers and toes after rewarming. A final diagnosis of stage 3 hypothermia and frostbite, including a diffuse distal small vessel thrombosis and probable pending limb loss, was given.
So for treatment of this patient, on the way to the hospital in the ambulance, he was initially treated with an IV of 150 milliliters of saline crystalloid solution, and then he was given morphine for the pain once arriving in the hospital. After the diagnosis of stage 3 hypothermia and frostbite, the treatment plan included internal and external active rewarming for the hypothermia with the use of forced air warming blankets, as well as increasing the room temperature. And they also administered IV fluids that were warmed up to 40 degrees Celsius. For the treatment of the stage 3 frostbite, active rewarming was also used, but for a more gradual thawing effect with immersion hydrotherapy, for both of the hands and the right foot in waters heated to 104 degrees Fahrenheit or also 40 degrees Celsius. After rewarming, the patient's injuries and circulation were reassessed, and the right foot and fingers still lacked perfusion, indicating the presence of thrombi preventing the restoration of blood flow to these extremities. So vascular thrombosis is treated with thrombolytic therapy to reduce the risk of major amputation. Thrombolytic therapy involves the use of medications to increase fibrin in the blood, and this will shrink and break down thrombi or blood clots, and this allows for the restoration of blood flow. The patient was administered an intraarterial vasodilator of 100 micrograms of nitroglycerin through 2 therapeutic infusion catheters placed in both upper brachial arteries, and another catheter could not be placed in the lower extremity to help with the right foot, unfortunately, because of the limitation of the total dose that could be given. But they hope that systemic levels of the tissue plasmagenic activator and nitroglycerin would be reached and help with the breakdown of the thrombi in the right foot. For the results of the thrombolytic therapy, these are angiographic images before and after 24 hours of thrombolytic therapy. So panels A and B are both before starting therapy, and you can clearly see where perfusion ends. For the white arrows, it shows perfusion in the thumb and ring fingers, but for all other 6 digits, those black arrows show where the blood flow is stopped, likely due to the presence of thrombi. And the cool thing we learned from this case was they asked the kid, why would your thumbs have blood flow? He was like, oh, well, I remember when I got really cold, I put my thumbs in my mouth. And then panel C and D show the patient's hands 24 hours after treatment, and you can see clearly improved perfusion in all 10 digits. So the ones that had perfusion now have more, and the ones with blood clots seem to have been broken down, and the blood flow has been restored.
So as she said, there was an improvement in digital perfusion after, it started after 21 hours. There was a pretty good improvement. After 24 hours, there was a dramatic improvement. There was a normalization of color, but after 24 hours, a groin hematoma did develop at the catheter entry site, or like a really bad bruise. So they did choose to remove and stop treatment after 36 hours. After therapy, there's not much that we can do. Once we try to do all we can for perfusion, there's not much more we can do but try and treat wounds. And so he was transported to a nearby hospital with a burn unit, and so ultimately the right distal great toe did not perfuse and was necrotic. There that is. Lovely. So yeah, the perfusion of majority of the extremities resumed, but there was severe damage to the skin, so he was transported to that burn unit for wound management, and so he was discharged from that burn unit after 11 days. The hand wounds healed completely, but the right distal great toe did not perfuse and was necrotic and was ultimately amputated. There you go. That's the toe. So after amputation, the patient did experience some neuropathic pain and sensory loss in his hands and right foot, but ultimately did make a full recovery and was able to continue playing hockey, and apparently had no negative impact on his performance.
For relevant clinical anatomy, for cardiodynamics, patients with hypothermia have abnormal depolarization and repolarization, which makes them susceptible to cardiac arrhythmia, which is when the electrical signals that coordinates the heart's beats don't work properly. There is 2 types, which is bradycardia, which is the slow beating of the heart, less than 60 beats per minute, and tachyarrhythmia, which is rapid beating of the heart over 100 beats per minute. And it occurs in patients with core temperatures below 25 degrees Celsius or patients with stage 3 hypothermia. And both of this can lead to cardiac arrest. In addition, rapid rewarming can also lead to cardiac arrest by causing permanent deterioration of the myocardial function and cardiac output.
For the nervous system, some patients, including our patient, will have some lingering neurological symptoms such as neuropathic pain, dysesthesia, which is sensory disturbances. They often have nociceptive pain, which is just like the pain receptors of the body are telling you you're in pain from touch that shouldn't indicate that you are in pain. For him, he had some briefly, but this resolved pretty soon. For some people, it's a lifelong thing. So sub-zero temperatures tend to lead to tissue freezing, electrolyte imbalances, pH imbalances, vascular damage, and cell death. And so also in cold damage, the skin undergoes a Hunting reaction, which it cycles between 5 to 10 minutes of vasoconstriction and dilation. And eventually all of these aspects will damage the sensory input and output of the body. And so also upon reforming, inflammatory response will actually arrest blood flow, which also doesn't help the nerves continue to maintain homeostasis.
For the circulatory system, this case relates to what we've learned in class about the circulatory system and effects that different substances and environments can have on circulation. And this case highlights the opposing effects of alcohol and hypothermia on the circulatory system. So hypothermia results in a vasoconstrictive effect, where the core body temperature drops dangerously, causing hypothermia. Blood is shunted away from the skin and to the core in an effort to conserve heat surrounding the vital organs. Alcohol, on the other hand, is a vasodilator, which results in increased blood flow, flushed skin, and a warming sensation. Alcohol causes the redistribution of heat towards the peripheries, and this increase in blood flow causes sensory receptors in the skin to detect an increase in skin temperature, and then that signals to your brain to start perspiration to help cool down, when in reality the body temperature has not been changed, it's only been redistributed, so it's really unnecessary for core temperature homeostasis for you to start sweating. The more blood, and therefore more heat, closer to the skin results in faster heat loss, especially in colder environments. And alcohol also reduces the body's ability to shiver, which is your body's natural means of creating warmth. And lastly, alcohol impairs the function of the hypothalamus, which is the part of the brain responsible for the stabilization of body temperature, which further compromises a person's ability to identify whether or not they are dangerously cold, and this only increases the risk of hypothermia and other cold-related injuries. This was a cool graph I found from a 2005 study, and it just shows the core body temperature difference in people who did not drink alcohol and who did. Just shows that body temperature drops. For the psychological effects of alcohol, alcohol consumption results in impaired decision-making as well as compromised sense of danger. The release of dopamine, which increases relaxation but impairs reasoning and memory. These slowed reaction times and decreased fine motor skills can also cause coordination problems at higher levels of intoxication. And just for a background on underage drinking and why it's really, really bad, is for teens especially, drinking is dangerous for all the previous reasons listed, but as well as that teens and adolescents, their brains aren't fully developed. The prefrontal cortex, the part of the brain that's in charge of rational decision making, this isn't fully developed until around age 25, in contrast to the limbic system, which is fully developed at around age 12, and this is the emotional control center of the brain, which is responsible for impulsive and emotionally charged decisions. So adolescents are more prone to partake in risky behaviors, poor decision making, and have higher impulsivity simply due to the stage of brain development that they're in, and then when you bring alcohol into play, it only exacerbates these risks.
We've decided to pick this case because of how relevant it is to Colby, since Colby is located in Maine, and we are like exposed to very cold temperatures in the wintertime. And there's like frequent parties on campus where alcohol is served. So we just want to spread awareness of the dangers of like underage alcohol consumption and binge drinking, and inform how severe hypothermia and frostbite can get, and how alcohol consumption can exacerbate a cold injury, and inform the public of like resources available for people that experience hypothermia and frostbite.